Patients always wonder, can my breast implants rupture? It's extremely rare that implants rupture. As a matter of fact, there's very small possibilities of that happening over the course of 10 years. The technology that is used now in creating those breast implants, in the case of a rupture of an implant, for the content not to be spilling out everywhere, it's mainly contained. It's a contained rupture. So how to know if your breast implant is ruptured or not? Of course, if patients start having some symptoms, a little bit of pain here, some deformity or retraction of the implant, those are signs that will lead us to start investigating more. But in reality, if nothing is changing, if the patient's feeling fine, how can they know if their implant is intact or not? So let me give you what the FDA recommendations are. 3 to 5 years after you get your breast implants placed, you need to have an MRI or a high-definition ultrasound. And after that, every other year, to continue watching and checking for implant integrity. These studies, the MRI or the high-definition ultrasound, are not going to be covered by insurance. An MRI, if you're looking for that study, probably you have to pay out of pocket anywhere between $2,500 to $3,000. So basically, if you think about it, after 2 or 3 of those studies, you're actually paying for a new pair of implants. So a great alternative to an MRI, it's a high-definition ultrasound. If an implant is ruptured, most likely you're going to be able to catch it with a high-definition ultrasound. So here at La Jolla Cosmetic, we do have a high-definition ultrasound available for any patient that wants to come and see if their implants are intact, if they are ruptured. So it is a procedure that's performed with this device right here. It's a high-definition screen with a high-definition ultrasound probe. And what we're going to be doing is we are basically going to be looking for the integrity of the implant as we scan the surface. And what we're looking for is to see and follow the shell of the implant throughout the surface of the implant. What we are doing is we are checking and making sure that there are no breaks, making sure that that shell is continuous. And then after us checking on your implants, we can reassure the patient that there are no ruptures, or at least that we're not seeing any potential sign that there could be a problem with their implants.